So tell us, what is self-medication?
Self-medication is the selection and use of medicines by patients or their relations without consulting a health professional. So they are doing the self-diagnosis and they are doing the self-treatment.
Okay.
And a lot of times it has to do with both prescription drugs and over-the-counter drugs. So it's not just the over-the-counter drugs or just the prescription drugs, but any of them, they just decide and go and buy
Okay.
and use without any input from a health professional.
Okay. So, given that this is what happens, give us like what would be a typical example of self-medication, just so that we understand it better.
For instance, someone develops a slight headache and a fever, and he thinks this feels like malaria, and so he goes to buy some antimalarials, and 2 or 3 days later he's feeling better, and he doesn't realize it's because he rested, probably. He assumes it has worked, and so he goes on his merry way.
And then next time he does it again.
Yes, because it worked the last time, you know.
Okay, all right. Okay, so what is the reality in Africa with self-medication? Because we saw from our Man on the Street segment that there wasn't a single, I think there was one person who said they don't.
It is very common. In fact, statistics tell us that in some southern parts of Nigeria, you have up to 100% prevalence of self-medication. In some parts of the South, you find that even pregnant women self-medicate.
Wow.
And even in the Northwest region, statistics from some states tell us that up to 85% of the population self-medicates. So it's widespread. It's a widespread practice.
Okay. And what sort of medications are they self-medicating with? I mean, like, what is, of all the things you could go out there and buy, what is usually the drugs of choice?
The commonest seems to be antimalarials. Almost half of the people who self-medicate buy antimalarials without any prescription.
Okay.
This is followed by pain relievers, all different types of pain relievers, paracetamol, non-steroidal, different kinds of pain relievers. And then antibiotics, which are drugs that are used for the treatment of infection. You remember the lady in the Vox Pop who said it's used for, as she called it, toilet disease.
Yes.
You know, so that's the third on the list. And then you have cough mixtures.
Okay.
And then other drugs like vitamins, laxatives, and so on and so forth.
And when they use these drugs, where is it that they're getting it from?
It was discovered that people who self-medicate get instructions for the use of the drugs from the people that sell the drugs to them, who most of the time aren't trained health professionals.
Yes.
About half of those who self-medicate would get instructions from the vendors. About a quarter would get instructions from friends and relations and neighbors who say, okay, I've used it for this and it works. And another quarter just gets the drugs just because they feel it will work, or maybe they've used it before when they felt they had a similar ailment, and then they use it. But what is even more dangerous is the sort of drugs that some people think are okay to buy over the counter and use without any professional prescribing them. They include aspirin, which is very dangerous, causes intestinal hemorrhages, Lasix, which is a diuretic that can cause heart attack, cardiac arrest, Indosit, which, by the way, most people know for use as something to use and kill rats, but which is really supposed to be some kind of a pain reliever. So there are all these dangerous drugs that people are buying on their own and feeling it's safe to use them without any professional's input. Okay. And that's the alarming thing about it.
Okay. Why do people self-medicate? Given that you and I know how dangerous it is, why do people self-medicate?
In a variety of reasons. Sometimes it's the distance of the health facility from the home.
Okay.
Sometimes it's the availability of funds to pay the doctor or to pay for the drugs.
Yes.
Sometimes it's also a perceived exploitation by private medical facilities. They feel they charge you so much and yet you get so little out of them.
Yes.
And then there's the issue of convenience. You think about getting up to go look for someone and sit and wait, and you think, okay, why don't I just do something at home here? It's quicker, and you know, it's more effective. Sometimes it's also because they think the illness is not serious enough. It's just a slight headache, you know, there's no need to go see a doctor for this. Sometimes it's also fear of hospital admission. they don't want to be admitted, so let me stay here because once I get there, they're going to ask me to take a bed, and I don't need that.
Yes.
And then sometimes it's just ignorance. They don't know.
It is important, right, that we know that even though some of these reasons are valid, there's still a problem with self-medication, right? And on the Vox Pop, we asked the question about herbal remedies. Why do you think people use herbal remedies over, say, conventional therapies?
I think many of them are cheaper, maybe.
Okay.
And some people are of the opinion that conventional medicines don't work. Maybe their father was a native doctor in the village and he used herbs for everything. And so they feel, look, if my father did it or my grandfather did it, then, that's the way to go.
Yes.
And then there are some who say that the conventional drugs are not effective. They just believe it's not effective. They don't even want to try it at all.
Okay.
So these are the various reasons why.
So let's talk about the problems with self-medication, all right? What is the real problem with self-medication? Why are we concerned about it as doctors?
We're concerned because there's the issue of misdiagnosis. Before you go and buy a drug on your own, you've sat down, you've looked at the symptoms, you've decided that this is what is wrong with me, you've decided this is the treatment I'm going to get, and you've decided that when I take this treatment, this is what I'm going to achieve. So you've taken over the job of many health professionals in the process of self-medicating. And you've also taken that decision not knowing that when you take those drugs, every drug causes adverse effects.
Okay.
But a trained health professional knows the adverse effects of whatever drug they're going to prescribe for you, and so puts that into consideration. Another thing is you find that when people self-medicate, sometimes they mix a lot of medications. Sometimes it's even, herbal concoctions with conventional drugs, or even conventional drugs with other conventional drugs, which a trained health personnel knows you shouldn't mix this drug with that. So these are some of the problems.
Another problem with self-medication really is masking
the symptoms.
The symptoms.
Yes,
so,
it could
by
the
taking some things, it'll mask exactly the symptoms of a more serious disease.
For instance, malaria. Someone doesn't know he has malaria. He thinks it's just a little headache. And so he keeps taking paracetamol, and then one day he goes into cerebral malaria and goes into a coma. And people say it's a sudden illness. But the paracetamol has been masking the symptoms of the more serious malaria that was there.
Yes.
So that's a really dangerous one.
Yes.
And then there's also the issue of sometimes developing an addiction, because some of the drugs that are bought over the counter are addictive, but people don't know. So you take
cough syrups.
Cough syrups, sedatives. A lot of people buy Valium every day and take it to sleep.
Yes.
They don't know it's addictive.
Yes.
So these things happen, but ignorance of these possibilities is what drives people to keep self-medicating.
So prescription drugs are prescription drugs for a reason, right?
Yes.
Because when you open the package that drug is in, there's usually a package insert, a paper inside, with a whole bunch of really tiny print, right? And what do most of us do with it?
You just toss it aside and, take the
But
drug.
all those things are all the possible side effects and all the problems with the drugs that we don't even pay any attention to, right?
That's right.
Yeah. So.
And expose yourself to the dangers.
Yeah, to the dangerous side effects of the medication. So let's talk about some of these dangerous side effects of the medications that we use.
For example, a lot of pain relievers, even the simple paracetamol that everybody takes, is known to be a leading cause of liver failure in the US and in the UK. And who knows the statistics here?
We don't know.
Because we pop it all the time. You have a slight headache. And some people even have the practice of, after a while, they say 2 doesn't work for me anymore, so I take 4. And you don't know you're damaging your liver. And then some would take paracetamol and mix it with another pain reliever. And when you have this combination of cocktails of analgesics, it causes kidney failure. So a lot of organ failures come from self-medication.
Wow.
Even some of these supplements that we have. There are a lot of supplements you find in the market that come from Asia. Some of them, the leaflets are all written in Chinese or something.
Yes.
And you have people who go around telling you it can cure this, it can do that. So you buy from this company, Another person comes with another one, you buy, and you combine all of them, and I believe that a lot of the cases of organ failure, kidney failure, the rate seems to be rising in our environment.
Yes.
Must be because of some of these things that we consume.
Today we're talking about self-medication with Dr. Chika. So Dr. Chika, we're addressing the issue of why we're so concerned about self-medication. So tell us some of the other problems with self-medication.
A big one is antibiotic resistance and antimalarial resistance.
Yes.
That's the real reason we're no longer using chloroquine for the treatment of malaria, because people just go and buy and take the amount they feel is okay for them. Once they're feeling better, they abandon the rest of it. And the same thing happens with antibiotics. Some people even use antibiotics for what they call prevention.
Yes.
So a young person decides to engage in some sexually risky behavior, and he takes some capsules of antibiotics before, and he thinks that protects him from getting some infection and things like that. And then you have people who have a diarrhea, and then they go and buy these red and yellow capsules and take 2 or 4.
Tetracycline.
Yes, and that's it. They don't bother to get the information about the correct way to take antibiotics or antimalarials. And as a result, you have resistance to these drugs. And then the drug companies have to find ways of getting newer and better drugs. And meanwhile, people are dying from these diseases. So drug resistance is a big one.
So that's a huge one, antimalarial and antibiotic resistance. What other problems? I know an issue is the issue of expired and counterfeit drugs.
Yes. It's funny, a lot of people in our environment think that the expiry date on a drug is minus or plus 3 months. I don't know how to say it. They say,
yes.
Okay, it has expired, but it still works for another 3 months or so.
Yes.
And so they go ahead and use it. But there's a reason why the date is there. Because after that, the constituents of the drug may become dangerous,
yes,
or at best ineffective.
Yes.
So those are some of the things, and I think it's because they're trying to maybe save money, or I don't know. But those are some of the things that cause a lot of harm in the people that use them.
Okay, and also I think one of the issues that we always talk about with medications is when we're talking about the issue of instructions on how to use them, is how you use the medications themselves.
Exactly,
right?
Because there are drugs that you should use only on an empty stomach for best absorption. There are some that you should use only when you've eaten. There are some you should put under your tongue. There are some you should swallow. So if you don't have the input of a health professional, how do you know what to do? You just take the drugs anyhow, and maybe sometimes they're not effective, or they could be dangerous.
And then you blame the fact that it's not, maybe you take more because you think it's not effective, or you try something else, when it is that you didn't use it appropriately.
Exactly.
Let's talk about some of just quickly, what are some of the things that we see when we talk about side effects? What are some of the symptoms of the side effects of this drug? What are they?
We can have different kinds of skin rashes. We can have symptoms from the digestive tract, like vomiting, diarrhea, and so on. And then you can have a massive allergic reaction, which could cause death, which we call anaphylaxis, which is like the end of it.
Yes.
These are all possibilities as side effects from drugs.
Okay. So we really have to be very, very careful. What can we do to prevent the practice of self-medication?
What we're doing now, educate the public, educate. We need to do more and more of that.
Okay. And I guess also the government has a part to play in all of this.
Definitely. Government has to put in place structures that are functional to control the sale and distribution of drugs, and enforce the use of prescriptions before people are sold certain kinds of drugs.
Yes.
And even the ones that they can buy over the counter, they have to make sure that the people selling them have information enough to instruct the people buying them as to the best way to use them to get the optimal effects.
Absolutely, absolutely, yeah. All of those kind of policies have to be put in place to protect the public from themselves.
Yes.
Because on our own, we just want to get better.
Exactly.
So we just go and buy the first thing we can lay our hands on, right?
Yes.
So, okay, so let's talk now about, we've talked about self-medication and why we shouldn't do it and the different ways we shouldn't do it and how we do it wrong. Let's give us some simple guidelines when it comes to medications.
Like I said earlier, it's good to get a recommendation of a place to buy your drugs from a trained health professional. And like you said earlier also, when you buy any drug, that little leaflet in the pack, just take the time to read it. Just in case the person that sold it to you didn't give you the information you need to know.
Yes.
Because you could find out, for instance, that what you're taking, you're not supposed to take.
Because of another condition you have.
Because of something else. Maybe you're hypertensive,
Yes.
and you just complained of headache, and they gave you something, and the leaflet says, not for hypertensive patients. But if you don't ever read it, then you're not going to know. So that's a very important one. Make sure also that the doctors that you see, quote unquote, are doctors. Trained professionals that you see are trained professionals.
Yes, yes.
I think the government has to help us there, because how do people know who is trained and who is not?
Yes.
But if we have people who are cross-checking and making sure that wherever you have centers that are open, that is trained professionals that are consulting there, then it helps the people to know.
Okay. What about some general guidelines for like use of antibiotics?
The prescription of antibiotics depends on age, depends on the condition being treated. For different conditions, the dosage may differ. For different age groups, the dosage differs, definitely. And then also, the dose is definitely not the same, for adults and children and all of that. But most importantly, what you need to know about antibiotics is when you start taking an antibiotic, you may not feel the effect till after about 2 to 3 days after you have started.
So don't stop it
So
prematurely.
don't stop and say it's not working. 2, you have to make sure that you complete the dose, even if you start feeling better midway through. Because there's that temptation to say, okay, I'm all right now, and then you stop. And maybe save it for next time you have a similar symptom.
Yes.
But that's a big mistake, because that's what causes the resistance. So complete the dosage no matter how you feel. Even if you feel better, make sure you complete the dosage. Most antibiotics, you'll have to take them for about 5 days. There are some that you have to take for 3 days. But just keep to the prescription strictly and complete the dosage.
Okay, what about antimalarials?
Same goes for antimalarials. A lot of, like now, we don't use chloroquine anymore. It's no longer recommended because it's not effective anymore for the treatment of malaria. So we use artemisinin combination therapy, ACT, like we call them. And usually, the dosage is for 3 days. So the same thing goes. Make sure you complete the dose, even if you feel better, after you've started, maybe a day or 2 after you've started.
Yes.
And the recent guidelines from Ministry of Health says that you should always do a parasitic diagnosis.
Yes.
So everybody cannot use a microscope to look for the parasite, but there are these rapid diagnostic tests, which are even sold in pharmacies now. So you can buy it and test and see if you have the malaria before you take the drug.
Yes.
So those days of, I'm feeling feverish, it must be malaria, you go and buy the drug, they're over. We're saying if you're feeling feverish, go get the test done. And then if the parasite is there, treat yourself for malaria and complete your treatment.
I want you to say one last thing on the issue of pregnant women, please.
It's very, very, very important, extremely important that pregnant women never, ever self-medicate. Because not only are they in danger, but the unborn baby is in danger. And there are many drugs that you could give to someone who is not pregnant, which are not safe in pregnancy.
Yes.
And it's only trained professionals, trained health professionals that know these things. So please, all pregnant women, don't ever buy a drug without seeing a doctor first, even if it's paracetamol, for your sake and for the sake of your baby.
Thank you so very much. Dr. Chika, this has been wonderful. I feel like we could keep talking about this issue of self-medication for another
Yeah.
full hour, because we sort of just touched very lightly on some of the real problems with self-medication, but we really appreciate your coming on the show and helping us to understand the dangers, the real and present dangers of self-medication. Thank you very much.
Thank you for having me.